Well, hello and welcome back to all of our Gold Learning family. It's great to have you here. I'm Fiona Lang Sharp. So excited to be sitting down with one of our speakers today for our Gold Midwifery Conference coming up. Welcome to Janelle Komorowski. Did I say it correct this time? I'm
Yes,
working
you
on
did.
it, Janelle. Thank you. That's awesome. Well, as you can see on the screen, Janelle's going to be speaking at our upcoming Gold Midwifery Conference, which we'll chat about in just a minute. And she's going to be talking about evidence-based pharmacologic management of nausea and vomiting in pregnancy, which is such an important topic. And Janelle and I were just chatting a little bit offline about that. But first of all, I wanted to get to know you a little bit better, Janelle, so I'm going to put you on the spot and ask you a little bit about your life and your career and those types of things. So perhaps you want to share a little bit about how it all came about. You have been a midwife for 32 years. What inspired you, and who have been your mentors in the field?
Well, I first became interested in midwifery when I was pregnant and working in labor and delivery. And the things that I saw, I said to myself, I can't have a baby like this. And I started seeking out other options and found a midwife. And from there, the experience that I had with her and my first birth just transformed me and inspired me to be able to support other women in being able to have the same kind of experiences.
Wow, that's amazing. And so that took you to the next leap of wanting to become a midwife. And
Yes.
yeah, and so, I mean, 32 years, that's some dedication there. You probably, when you look at that number, you think, wow, where did it go? But I know you've been working hard. So tell us what has kept you in the field and what are you doing now with your skills?
Well, I don't know if it was so much dedication as just I love my job. I love working with moms and babies, and it's a way to feel like you can really make a difference in someone's life and in a small way, maybe making a difference in the world because we know that birth can affect everything that comes after that. And so I have a job. I feel so lucky to still be able to get excited about going and doing the same thing that I've done for 32 years.
Hmm. No, that's fantastic. And tell us a little bit about, I see that you are part of a part of a committee called the Right Care Alliance Women's Council. Tell us a little bit about that and how a person would be involved in something like that.
Well, the Right Care Alliance is a group that works to try to establish right care, exactly as the title says, and it looks for ways that healthcare can be improved and involves everyday citizens as well as healthcare workers in working to make improvements. And the Women's Council focuses specifically on issues that are important to women.
Right, right. And so you said healthcare workers as well?
Yes, anyone can be involved.
Oh, that's amazing. So if you're a student midwife or you're someone that's in the birth field, this would be something that you could be a part of an advocacy program and something like that. Is that correct?
Absolutely, and they are always looking for, we love students because of their enthusiasm and they're not jaded like the rest of us tend to get after a while. So yeah, we're thrilled to have students or anyone that cares about making sure that healthcare is done right.
Yeah, that's amazing. One of the things that, just a side note about Janelle is that she lives in the mountains, and she lives in a tiny home. Now, Janelle, I wanted to ask you about this because this is something that is a little bit unusual still. A lot of people talk about living off the grid and, moving to the mountains, but what took you there and how has this, complemented your life?
Well, we had always wanted to have some land in the mountains and just have a beautiful outdoor lifestyle because we really enjoy hiking and nature and gardening and all of that. And we got excited about the tiny house movement through watching the shows on TV. And there was a company in the area where we lived that built tiny houses on trailers. And my husband said, I could build that. And so we
Wow.
decided to build our own little tiny house, and we did it together, and it was so much fun. And we stayed married. So um, and it's to me, it is just so refreshing to not have lots of things that I have to take care of. My house is small. It doesn't take long to clean it, and I get
Perfect.
to spend my time in the outdoors.
Oh, that's amazing. That is amazing. Well, you're a true testament, to working your life, not only in the field, but also in practice too, and keeping things simple. Seems to really be working for you. And here you are, still working in the field and doing such a great job. So thank you so much for all the things that you've been doing, Janelle.
Thank you.
Okay, so let's shift gears now. Let's talk about the topic. And I had said to you, no, I'm really excited to hear more about this, just because I think it's an area where, again, sort of, a lack of knowledge that's out there and, trying to really understand how to support women. Nausea and vomiting, as it says in your abstract, is still continues to be very persistent, hard to manage. I'm part of a couple of groups and listening to mums talk about this a lot. So tell me, Janelle, how did you come about wanting to speak about this topic?
Well, I think that nausea and vomiting is one of the most common things that we as care providers have to deal with, and yet one of the most frustrating because it can be so challenging when you have a mom that you're caring for and you try one thing and then another and nothing seems to be working and the mother is obviously getting very frustrated. That's frustrating for us as midwives as well. And so I started wondering, is there anything better? Is there anything more that we can do? And I think the other thing that happens is because it is so common, the tendency is to just say, well, this is just a normal thing and you just have to deal with it, and to kind of brush it off and not take it as seriously as maybe we should sometimes.
Yeah, absolutely. So in your discoveries and what you're looking at, have you seen things change over the years, Janelle, or are we simply just trying to redo? Like what's coming up for us right now?
No, things have definitely changed over the years. When I started as a midwife, there weren't a lot of options for treating nausea and vomiting pregnancy. And since that time, there's been a great deal more research done, so we have a lot more evidence on what really works, as well as what are risks and benefits of the different things that we can try. So yes, things have definitely changed and progressed.
Perfect. Well, I mean, it's good to hear that there is a progression. Give us a couple of key things that you're looking forward to sharing with our delegates through this presentation here at Gold Midwifery.
Well, I'm looking forward to talking about the women that use cannabis and how that can affect hyperemesis. That's a big way that women are commonly self-medicating, and I think it's more common than what a lot of providers realize.
Right.
And also some of the um, more simple remedies that now we have done randomized controlled trials and we have solid evidence of what will work. And so
Right.
there's some very simple things that can be tried as well that can be effective for nausea and vomiting in pregnancy.
Well, that's fantastic. Well, yeah, I'm really looking forward. Of course, a lot of talk about cannabis these days of use during pregnancy and post-birth. So it'll be great to get up to date and hear what's happening with some of those mothers and some of the things like you mentioned. Sometimes we need to go back to the simplistic. Easy versions of what we've been doing, although there are plenty of medications on the market too that weren't always available. So it'll be great to
Yes,
get an update on that as well. Thank you so much. Well,
you're welcome.
thank you, Janelle, for being with us here today. It's been great getting to know you a little bit more and hearing more about this topic. Of course, for those of you listening in, do go to our website. Janelle is on the lineup. She is slated for Tuesday, the 12th of February. So, and check that time zone for yourself, of course, at goldmidwifery.com. kickoff date for this conference is February 4th. So we'll look forward to seeing all of you there then for a free and open keynote as well. Thank you again to Janelle for joining us here today, and of course to you, our listening audience. Bye-bye for now, everyone.